Good morning, Mr. Jones. This is Albert. He's the RN that'll be taking over for me. He is going to take good care of you.
Good morning, Mr. Jones. It's very nice to meet you.
Mr. Jones came in 2 days ago with shortness of breath that had been increasing over the last week. He was admitted with a diagnosis of CHF exacerbation. Dr. Dude has been following him from Dude's cardiology. His admission weight was 104.7 kilograms and his BNP was 3470. He received Bumex IV push in the emergency room and then was admitted to our unit. His weight is now 100.2 kilograms this morning. His dry weight from a previous admission was 96. So he has a little ways to go. His BUN and creatinine are stable.
What goals does Mr. Jones have for discharge?
Well, Mr. Jones is now on oral Bumex and continuing to diurese well. He was a little deconditioned on admission, so PT and OT are working with him to increase strength and activity tolerance. He has some new medications that he needs some education on, as well as CHF education. The plan for him is to be discharged home with his wife, Jamboree Jones.
Very well. What immediate goals does he have for the day?
The goals for the day are to discontinue the Foley catheter and increase his activity as he tolerates. The doctor wants Mr. Jones up in the chair for all meals. Mrs. Jones will be in this afternoon, so it'll be a great opportunity to discuss diet and other CHF teaching.
Great. Let's put our goals up on the whiteboard while we update it. What are Mr. Jones' most recent vitals?
The goals are on the board already. It worked out. Chester must have done that. Mr. Jones remains on 2 liters per nasal cannula with O2 sat in the mid-90s. He has a slight crackles in his bases. He states that shortness of breath is greatly decreased, so he may be able to wean his oxygen off today. He's in sinus rhythm with occasional PVCs. His last blood pressure was 156 over 78. Beta blocker was added today to help control his hypertension, and he's been a febrile.
Does Mr. Jones have any IVs?
Yes, Mr. Jones has a right triple lumen IJ. The dressing is dry and intact with a bio patch in place. He is eye-locked except for a CVP line. CVP is to be checked Q4 hours. I have been checking with his head of bed at 20 degrees.
How has Mr. Jones been getting up? Ambulating?
He has been up with a 1-person assist and a gait belt. He also uses a walker. He uses the call light appropriately, and bed alarm has not been needed. He has not had any history of falls.
Any pertinent skin issues we are addressing?
He has a small abrasion on his left forehead/eyebrow, right here.
Okay.
States are in his head while getting into his automobile.
I can be so clumsy sometimes.
It looks like it's healing well.
Yes, it has been open to air and no drainage present. He does say it's slightly tender palpation.
Very well. It's nice to meet you, Mr. Jones. I have to finish report on my other patients, and then I will be in to see you. Is there anything we can get for you right now?
Oh, no, I'm okay, son. You guys take such good care of me. I'll use my call light if I need you.
Great.